Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you. That's right, Q&A, question and answers, brought to you by you. I have to say that the questions that people have been asking are getting better and better, much more relevant and specific. Excellent questions. So we've, over the last few days and weeks, have been asking for people, hopefully they'll be patients, people to write in their questions, and we've sort of put them together in categories, right. And we're gonna start to address them. And I think it'll take a few Q&A sessions to get through all of them, but let's dive in, Maria. What you're gonna be talking about, the face, the eyes, and the nose is the set of questions now. So what do you got?
Okay, we're gonna start with Anna_Smolska. Does lower upper bleph inside scars affect vision in a long-term perspective, like 7 years?
Okay, so the question, I'll rephrase it because it wasn't actually done very clearly, was, do the scars associated with upper and lower eyelid surgeries affect your vision? That's really the gist of it. Mm-hmm. And the answer is they shouldn't, because we're working on the lids, that is the things that cover the eyeball, and they shouldn't impact the vision at all. However, if the surgery of your upper eyelid or your surgery of your lower eyelid is done incorrectly, then your eye will not close well, meaning they took too much skin from the upper eyelid or too much skin from the lower eyelid, and you physically can't close your eye at night. Then you have to patch it, and there's a reason we blink. We blink to create fluid over our cornea. If I kept your eye open like this for more than 30 seconds, you will start to dry out and you'll get a corneal abrasion. And then if you get a corneal abrasion, it'll impact your vision.
And it's very painful.
Very painful, but it's indirect, and no, theoretically, they shouldn't impact your vision.
Okay, the next question comes from Angela Nicole _92.
Got it.
Is it necessary to break nose during a rhinoplasty if you already have a narrow nose?
So there's this, every procedure has these like urban things that people are fearful of. Like in tummy tucks, are you gonna have drains? In, with noses, there's this infatuation with breaking the nose. First and foremost, you don't know the difference if you break the nose or not. Yeah, there's a little more bruising, but it's irrelevant. You need to do the things you need to do. A. B, 99% of the times where I do a rhinoplasty, I end up breaking the bones of the nose because almost everyone's nasal bones are asymmetric. And your goal at the end of the surgery is to create more symmetry, not symmetry. And even if your nose is narrow, there's often some asymmetry, and when I break it, I don't necessarily push them together, but I release them so they sit right. The last thing is, if I remove a huge bump on a nose, even if you're narrow, that when I shave off the bump, the front of the nose becomes flat. It's no longer round, it's flat. And you need to break the bones to re-round the nose. That's called an open roof deformity. So the answer to your question is, forget about the breaking of the nose. It's irrelevant. Don't worry about it. Pick a surgeon who knows what they're doing, and they'll figure out if it's necessary. But I do in 95% of the times.
Okay, the next one comes from Charlene Johnson. I had a facelift in my early 50s. Will I at some point need to do another lift? And if so, will it be considered more complicated than the second time around?
So, good questions. I've constantly asked this question. 15 years ago, you waited till you were late 60s, early 70s, do your facelift, call it a day. Now, and rightfully so, patients are starting to do them in their early 50s, late 40s even. And so you're getting the benefits of A, having to do a smaller lift because you don't have as much, and B, you're enjoying it in your 50s and 60s. But obviously, you're living longer. And so naturally, in 15, 16 years, you may need a small touch-up. So it's very common every 10 to 15 or 20 years to need a little things cleaned up or tightened up if it still bothers you. The question she's asking, is it more complicated? And the answer is not really. As a matter of fact, the skin itself leaves a scar tissue plane, and getting in is actually kind of easier. Some surgeons find getting in the second time easier than the first time, but certainly not much more complicated.
Well, an example is Jane Fonda. She gets it.
Yeah, every 15 years, you go and tighten things up a little bit.
Okay, we have from Flower Lover 1939, do you do vertical facelift? First of all, what is a vertical facelift?
Yeah, that's what she asked you. So, as you know, I just did 2 podcasts on facelifts. Facelifts are one of those procedures that doctors love to create marketing schemes around. You don't really have that with ear pinning. You don't have the Rubicon ear pinning, the midnight ear pinning, the chocolate lovers ear pinning. You don't have that because it's not a very expensive procedure. Facelifts, people love to put something in front of the word facelift. So it's the vertical facelift, it's a mini facelift, it's a lunchtime facelift, it's the Rahban proprietary facelift, the ponytail facelift. It's nonsense. What it's talking about is that historically we used to pull the face more backwards. And that's not the right vector, meaning the direction of the pull, because when we age, we're sagging downwards. And if you pull backwards, your neck skin doesn't get better, but if you pull upwards, vertical, the skin sweeps up better. So the idea with the term vertical facelift is your surgeon is suggesting that the movement of the skin is more vertical than horizontal. And yes, in all of my facelifts, the way I do my facelifts is it's two planes. It's the skin and it's the muscle. The muscle needs to go up because the muscle was here and now it's fallen. The muscle has fallen from your cheek to your jowl. So the muscle is vertical. The skin doesn't go up like this. The skin doesn't go back like this. The skin goes back at a 45-degree angle along your jawline. So it's just nonsense as far as I'm concerned.
Okay. The next one comes from Farfaran. What can be done other than filler for under eye? Can you fill with plasma?
What can be done for under the eye except for filler? So under eyes are very tricky, actually. Very, very, very tricky. First of all, it's got a really treacherous anatomy. It's paper thin. There's a lot of key components. Second of all, the problems with the under eyelids are not singular like the upper eyelid. 99% of the problems with the upper eyelid is excess skin. So you remove the excess skin, you're a hero. Lower eyelids, you have A, excess skin, B, fat herniating, C, hollowness. There are three different, and D, color discoloration. So they have nothing to do with each other. So fixing a lower eyelid depends on what you're fixing. If your issue is hollowness, then what you can fill the hollowness is with filler, fat from your body, or repositioning of the fat in your eyelid downwards. So you're filling in the hollowness. If your issue is skin, then filling is not the issue. The issue is you got to lift the skin and remove the excess. So volume replacement can be done through filler, fat transfer, or repositioning of your own fat.
But not plasma.
I don't even know what plasma means. Plasma is like, to me, plasma is they take your blood,
right?
They spin it,
because
and
they
re-inject
do that in
it.
Miami a lot.
They call it the vampire facelift. It's just all that is.
I think Kim Kardashian.
Whatever. What it is plasma is taking your own blood and re-injecting it in you with the assumption that there's fibroblasts and things that make it heal. That is not going to stay. It's a serum. It's serum. So if I fill the lower eyelid with your own blood, it's going to go away. It has to be something that stays.
Right. Okay, the next one from Galina, 45781. Is it true that after the age of 60, it's not good for the facial muscles to get Botox?
Yeah, I've never heard that in my life. So what you'll notice about Botox in the older years is as follows. Your tissues have sagged a lot, and your muscles will be much more sensitive to the Botox in that when you're 30, your eyebrows are high, and you have wrinkles, but your eyebrows are high. So when they put Botox, your muscles don't drop. So you can get Botox, no wrinkles, and your eyebrows stay high. When you become 60 or 70, your eyebrows are settled. You inject the Botox and your eyebrows settle more because they've become lax and you need a brow lift. So it's not so much that your muscles atrophy or whatever. It's just that you're much more sensitive because when you Botox something, it relaxes a muscle and you're already super relaxed when you're 60. Everything's sagging.
Horrible.
Sorry, Maria. But anyway, we can fix that like in 2 seconds.
Yeah.
Like,
give me about a year to
you want to recover from your breast? On the contrary, you got to hit the ground running. You're in it.
Tell that to my husband.
You don't need to have this conversation with him.
Yes.
Just show up.
Yeah. Ballyviews92 says, does lower blepharoplasty sometimes need to be done twice? Can sag and puff return?
Does lower blepharoplasty need to be done twice? So the answer is shouldn't be, right? Every procedure we do with time may reoccur, right? We take up the skin of your upper eyelids, 25 years later, you may need it again. We do a facelift, 25 years later, 10 years later, you may need it again. The lower eyelids, though, tend to be pretty bulletproof, and you shouldn't be required to do them over and over again. Could you? Sure, but it's not customary.
Okay, when we come back, we're going to have questions on recovery and general surgery.
You want to take a break? Okay.
Yeah.
I got you. Maria's tired. All right, guys, we're going to take a quick break. We're going to come back, and then we're going to keep answering your questions. They've actually been quite good. Let's take a quick break, and we'll be right back with plastic surgery uncensored. All right, welcome back to Q&A, questions and answers, second half. And we're shifting energy from the face and nose and eyelids, and now we're going to be talking about general recovery type questions that you guys sent in. So who do we got?
The next question comes from Chanel Nelson 75.
Chanel Nelson 75. What you got?
If I've had an addiction in the past to pain medication, would I still be a candidate for surgery? And how would the pain be managed if there's a history of substance abuse? Which I thought was a really good question, because I said, I wouldn't have thought about that.
Yeah, good question. So everyone who has a history of substance abuse is at risk for falling off the wagon, right? For getting, the key to substance abuse recovery is abstinence, just staying away from the stuff altogether. But when it comes to surgery, it's very difficult to stay away from narcotics because you're in pain. So I've had many patients who have been previous substance abuse individuals who are now in recovery and have abstained, and we manage. It turns out that, number one, you try to really, really limit the amount of pain medication you use. So during surgery and afterwards, we try to use other modalities like numbing medicine. So for example, during the surgery, I put a lot more numbing medicine so that the amount of narcotic the doctor needs is lesser. Then after surgery, luckily, I never in my 20 years have given anyone more pain medications than 7 days. Zero, zilch. I don't care if I redid your entire body, 7 days, no more narcotics. So we just, during that week, we try to minimize it. You take Tylenol. I'm not a big fan of anti-inflammatories for the first week because of bleeding, but maybe you take it and you modulate it and you just get through the first week, because no matter what surgery you have, within a week it's over. Yeah. So if you can manage a week, then you can really mitigate how much narcotics you take. And chances are that, there's been well documented that people who are in pain, acute pain, meaning just after surgery, tend not to be a trigger for substance abuse, but rather chronic pain. Mm-hmm. I've been on these medications for 3 years, my back pain, my knee surgery, whatever. But I just had, my gallbladder removed and I've been on narcotics for 3 days. It tends not to be a link, although granted, you want to stay away from it. Yeah,
because when you did this at my breast surgery, I think I only took the pain 2 days.
Yeah, well, that's in general, hopefully a low pain procedure.
Next one is Alyssa Marie 95. I saw a recent post on labiaplasty. If it's the only procedure you're doing, are you able to do it under local anesthesia?
It's a good question. So we just had an episode with our anesthesiologist, and we talked about the distinctions with the different types of anesthesia. There's local anesthesia, just conscious sedation or twilight, and then there's general anesthesia, and then there's epidurals or nerve blocks. It turns out that labioplasties, if that's all you're doing, can be done under local. So naturally, you have to localize it. You have to numb it. So the person has to be able to tolerate the numbing part, but once it's numb, you're good to go. So you can put some topical numbing medicine, let that area become more insensate, inject some local, and do the procedure under local. Yes, you can, absolutely.
Next question comes from Sean, 1456. What are your thoughts on hyperbaric chamber to aid in post-op recovery?
It's a great question. So in general, anyone that knows me, has followed me, knows anything about me, knows I'm super, 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 super anti-gimmick. I hate it. So there's constantly things that are being suggested or brought up, and this is lymphatic massage or this wrap or mesotherapy, and I just don't buy it. I just don't buy it. Having said that, I think that there is validity in hyperbaric chamber, so much so that it's something that I recommend in certain patients, and it's something that I'd actually consider getting here for our practice. The problem is I don't know to what extent it helps. I don't know in whom it helps. I don't know how it helps. Now, how I know. So what is hyperbaric chamber? Hyper means excess. Hyperbaric oxygen chamber means that you have high levels of oxygen. So it's a technology that was invented for scuba divers. And what would happen is that if you went scuba diving and then you end up getting the bends and nitrogen would get into your bloodstream, you would need to knock the nitrogen out of your bloodstream by pushing more oxygen in. So scuba divers would go into these chambers, like big ass chambers where they'd lock the vault and they would pump oxygen at 2 atmospheres. So we live at 1 atmosphere. So the oxygen is twice the level of normal, and your body, you breathe, just normal breathing, you have no pressure, your lungs don't explode, you get a little bit of a headache. And then if you do this for about an hour, your level of oxygenation in your blood goes up. And they also started to learn after a period of time that, there's more oxygen in your blood, so therefore, in areas where there's not enough oxygen, things are healing better. So it became very common for chronic wounds, areas that were just shitty. You had diabetes and you weren't getting blood supply to your foot. You had an ulcer, you had diabetes, your arteries don't work. And so if you push enough oxygen into the blood, what does get there has more oxygen and it would heal. Now it is being more suggested prophylactically, meaning when you have a facelift or a rhinoplasty or a tummy tuck, there's nothing wrong with you and you'll heal fine. So the question then becomes, is it going to make it better, faster, quicker, less swelling? And there is some documentation that it does, and it's a little hard to calculate. Where I use it for sure is in redo surgeries, like if you're getting a redo breast reduction and you've had a previous anchor or redo belly button where I'm worried that something might die. Then I always recommend it, right? A redo something.
Yeah, like the breast, the nipple.
Right, the nipple part or whatever. But I do think with time I'm probably, when we were contemplating having a hyperbaric chamber, which is a big deal. If you're gonna do hyperbaric chamber, listen carefully, 90% of them are gimmicks. Because we are at 1 atmosphere. For true hyperbaric chamber to work, you gotta be at 2 atmosphere. To be in 2 atmosphere, you have to be in a chamber locked. And they have to have a huge oxygen silo to do it. So most places
Not
can't.
a little capsule type of
Right,
thing.
so most places can't do it. What you do is you go to these spas and recovery centers and they're like, oh, you're here healing. We're gonna blow oxygen by you. And you go in this little like tent and the oxygen levels get to like 1.3, 1.4. And that's not true hyperbaric chamber. That's like bullshit.
Okay, the next question comes from Jana_Gordon75. If I travel to you for surgery, how soon am I able to fly back home safely? I can answer that. No.
So the answer, Maria, just recently had her surgeries. I require patients, especially on large surgeries, to stay put for 2 weeks. If you're coming from Dubai, you're coming from New York, it depends on what you're having done. But if you're having like a tummy tuck or a breast reduction or a facelift, I want you around for 2 weeks, and this is the reason. In that first 2 weeks, 95% of things that could go wrong, which thank God they don't, but 95% of things that could go wrong will have gone wrong. And you are here with me. What we don't want to happen is you get on an airplane, you fly back to wherever the hell you are, and the next day you develop an infection or this or that or whatever. And all of a sudden you're calling me and I'm like, well, shit, you're in God knows where you are. Go to the ER and some asshole has to take care of you. I am offering to take care of you. Just stay here for 2 weeks and then you can leave. And everyone leaves after 2 weeks.
Yeah, and I think it's a good idea. After the fact, I do. Okay, Francine_AZ. What are the most important things to look for when choosing a surgeon?
So this is a loaded question, and it's a question that we devoted an entire podcast, and we should really redo it. We haven't done it in a while. So but the things are, there is no secret sauce. It is the sum total of a bunch of things makes you more likely to have a good outcome and less likely to have a disaster. But it does not guarantee you anything. And the less of these things you have, the more likely you are to have the shit go wrong. So, number one, the doctor's training is by far one of the most important elements. So we have had discussions about the best person to do a procedure is a board certified plastic surgeon, board certified in plastic surgery, because they could be board certified in something else. Then a plastic surgeon who isn't board certified, and then. There are cosmetic surgeons who are OBGYNs, ENTs doing tummy tucks, dermatologists doing facelifts. It's a shit show out there. And they're all calling themselves cosmetic surgeons, and they're board certified in something, and it's a alphabet soup. So if your doctor does not say board certified plastic, not facial plastic, not cosmetic, plastic surgeon, and you go to the American Board of Plastic Surgery and they're not there, move on. Then you want to make sure you check the state agencies. We're in California. California Medical Board. Does this person have suits against them? 1, 5, 9? I mean, shit, there's this guy's had 6 people complain about him. What are the chances that all 6 people were wrong? So that's the second. Next, you go online, look at reviews. They are subjective. You're looking for trends. If every review says, Dr. Rahban is amazing, he's fantastic, love him, and that's the extent of the review, that's a little suspect, don't you think? Yeah. I mean, people write a review, they write a review. I went to 17, I'm 35 years old, I came from Arkansas, people write shit. Conversely, if people are writing negative things, I don't like Dr. Rahban, he's an asshole, he wasn't very nice to me. Okay, well, he wasn't nice to you. What happened? Did your nipple die? Did you end up having an infection? So there are sometimes people's negative reviews that are not effective, and then you look at a pattern. 8 people write the same thing. Dr. Rahban's staff was da-da-da-da. It was not a clean place. When I called, when I had a problem, no one picked up. Okay, now I see a pattern. Next, you want to go on there and scour their work. You're going to a plastic surgeon for their aesthetic outcome. Right? You're not going there to be their friend. You're going there. And so you should not see 6 or 7 things you like. You should see 50, 60, 70 photos of outcomes you like. And there are many more things that you can look for. And then last but not least, your gut. Your gut feeling is so important. Not necessarily not in and of itself alone, but in conjunction to other things. There have been many instances where people have told me when they come for revisions, like I went there and I was like, I didn't really love him, but I just said fine. And then things went awry. Whereas if you went and you did all your homework and they seemed great, and then you do you interview, you consult with them, and you should consult with a few people. Never just go, Dr. Schmidt, he's the best. And you're like, wow, this guy's really great, or this gal, then that has some value, So I think that and a bunch of other things.
Yeah, I think that the connection that you have with the doctor is very important. I mean, besides doing all the other review. Well, we've run out of questions, but we have one favorable review. One favorable review,
because we don't read anything that's unfavorable, and I'm just kidding.
No, we have one additional review that came out from Very Helpful Info. I have been listening to this podcast for a while now and find Dr. Rahban's honest takes very refreshing and informative. I hope he keeps putting out great content. I also appreciate the guests he brings on the show. Thank you for doing this great work.
Well, you're welcome.
This is from California Girl 8208.
California Girl 8208, we applaud you. Thank you for sharing that. Because at the end of the day, the podcast is time consuming. It's on Sundays. Maria comes from Miami. I mean, it's a big shebang. And the only thing that it's done for is for people to listen and gain knowledge. And as a result, instead of going right, they go left. If they were going to go left, they go right. So it's really nice to hear from people who find the information informative. Even if you're not having plastic surgery, you just don't know when you're going to need to know. So we love you and we appreciate it. So spread the word. As always, before we exit the show, we ask you to do exactly that. Go and share. We loved it. It was great. Give us some feedback. Positive. Mm-hmm. And the other is to share the show with everyone you know, because you think you know who's going to do what, when, where, and the reality is that you never know. And then next thing you know, you find out that someone you care about had a really bad outcome and you would wish they had gotten some information. All right, guys, that is a wrap. We have many, many more Q&As. Keep it coming. You guys do a great job. We'll do yet another episode soon. And as always, I'm your host, signing off on Plastic Surgery Uncensored.